Good morning, everyone. Welcome. I'm Dr. Jyoti Patel. This segment is called The Middle Road, where Eastern and Western medicine meet. I practice internal medicine and pediatrics, and I'm an integrative specialist. So welcome. Today's topic is on autoimmune conditions. It's a very important topic. Again, as you know, March is Autoimmune Awareness Month. So if you're not familiar with what autoimmune conditions are, you may have heard of conditions like rheumatoid arthritis, lupus, Hashimoto's thyroiditis, celiac disease, ulcerative colitis, Crohn's disease, psoriasis, eczema, vitiligo, multiple sclerosis. These are all autoimmune conditions, and they all have a common theme. They all start from the immune system. So just to take you back, your body is made up of trillions of cells. So let's say 50 trillion cells. Each cell is a living, breathing, live unit. It senses its environment, and then it translates the environment into action. So just like any child, if you put a cell in an environment that's toxic or harmful, then the outcome might be damage to the cell and bad results from the cell. If you put that cell in a healthy environment, if you put it in a conducive for health environment, then that cell is going to thrive. What happens in autoimmune conditions is it's not really the end organ that's the problem. It's the immune system. Now, if you have an autoimmune condition, there's lots of them. There's over 100 of them. So I'm not going to be able to address all of them today, but I'm going to take a broad sweep to talk about the commonalities and some of the treatment recommendations for autoimmune conditions. If you have any questions, please don't hesitate to ask. I love answering questions. It's easier than talking to an audience, okay? So once we talk about autoimmune conditions, it's important to think about the gut, because the place where the immune system is 90% active is your gastrointestinal system. So today, just to give you a bird's eye view of what we're going to talk about, we're going to talk about elimination of foods that might be triggers, elimination of toxins that might cause disease, elimination of infections that might contribute, and then I'm also going to touch on how to replenish your system with health and nutrition and vitamins and supplements and food additives that can help you restore your gut health. But not to leave out lifestyle, we're also going to talk about stress management, exercise, and sleep, because these are paramount to controlling your autoimmune condition. Okay? All right, so first thing, elimination. If you have an autoimmune condition, you've probably already looked this up. There's a lot of elimination protocols out there. It can be so confusing. I myself have been confused about it in the past. But here's the thing. No matter where you start, there's a common theme with all elimination diets. It goes without saying that if you eat foods that are highly processed, hydrogenated oils, high fructose corn syrup, these include things like soda and candy and cereals and bread and pastries and junk food and fast food and fried food, basically the standard American diet. If you are going to incorporate these foods into your meal plan, your autoimmune condition will likely flare. So the common theme with elimination of food diets, whether you follow Dr. Wall's multiple sclerosis diet or the autoimmune protocol or the anti-inflammatory diet, or you decide to go on the FODMAP diet, or you decide to do just an autoimmune protocol, this is the base. You have to take out the junk food from the diet. So if you're opening up a box, you're opening up a can, you're eating food that's already prepared, if you're doing a drive-through to pick up food, these foods are going to cause flares, so cut that out. Second is, autoimmune patients typically are sensitive to certain food groups. So this was also generally the same theme throughout all the protocols that I looked at. Grains. Now I know that celiac patients focus on gluten, but autoimmune patients in the beginning find that they might be more successful in getting into remission if they cut out all grains, beans, legumes, and dairy from their diet. So looking at all the protocols that were out there, and of course, Dr. Walls has published some significant data in multiple sclerosis in her protocol. These are the top 4 things. So again, it's dairy, grains, beans, and legumes. Now, there are some additional things that some of these protocols individually cut out, and you take this as you see fit for your own body, because remember, there's not one diet that fits all. You want to eliminate the things that you think might be triggers and then work backwards to introducing them back into your diet slowly. So if you have thyroid disease, some patients will try to eliminate soy products or nightshades. They find that these nightshade vegetables can sometimes be inflammatory for them. If you're not familiar with nightshades, these are things like eggplants, potatoes, okra, tomatoes, and eliminating them for a short period of time to see if there are triggers is going to be a good thing for some patients. Some people will actually eliminate beans like chocolate and coffee, and they find that these can be sometimes triggers to that HPA axis, that stress response, so they cut that out in the beginning to kind of get their autoimmune condition into remission. Some people will actually reduce citrus, alcohol, soy, corn, so there are some other protocols that have a more restrictive diet. So you say to me, now I've cut out everything, what can I eat on this autoimmune protocol? Well, it's interesting that when you look at the different protocols, they have a common theme, again. So let's take Dr. Terry Wall's multiple sclerosis protocol for autoimmune conditions. She's actually published data and continues to do studies to show that she can put people into remission with her diet. So she has this protocol where she does 3 cups of leafy green vegetables. She's a big believer in leafy greens. So she says 3 cups of leafy greens every day. You can 3 cups uncooked, and then of course you can cook them if you want to. 3 cups of sulfur-based compounds. So you may say, what the heck is sulfur-based compounds? These are onions, garlic, mushrooms. Some people don't tolerate them, but in her diet plan, she has 3 cups of sulfur-based vegetables. These also include cruciferous vegetables. Now these are broccoli, cauliflower, cabbage, Brussels sprouts, kale. So you can add these in too as far as the sulfur-based compound. Okay, so 3 cups of greens, 3 cups of sulfur-based. She also has 3 cups of flavonoids. Flavonoids are basically pigmented fruits and vegetables. You've got your blueberries, your beets, your raspberries, your strawberries. Those heavily pigmented fruits and vegetables have flavonoids in them, antioxidants that help protect the tissue. So she definitely recommends adding 3 cups of flavonoids or pigmented vegetables. Okay, so that's a common theme. You're going to hear me say fruits and vegetables a lot, because it doesn't matter if you're going with Dr. Weil's anti-inflammatory diet, or if you're going on the FODMAP diet, or you're choosing Dr. Wall's diet. Fruits and vegetables are key. So 3 cups of greens, 3 cups of cruciferous or sulfur-based products, and 3 cups of highly pigmented fruits and vegetables. So that's Dr. Wall's. Now, she also adds in there 80 grams of fiber. She believes that if you have stools that are pellet-like or stools that are pudding-like, you still have problems with your gut, and she'll ask you to increase your fiber if you're constipated and decrease your fiber if you find yourself having too much of a runny bowel. So she titrates the fiber intake based on how much poop you're having. So watch your poop and increase your fiber, because this is also part of autoimmune healing. Here's where Dr. Wall's diet might differ from your meal plan. She actually recommends adding organ meats, grass-fed meat, and wild-caught fish into the diet. Now, you might be vegetarian or vegan, and this may not be in your bandwidth, but the reason why she suggested that autoimmune patients should consider this in the beginning to get into remission is because it's highly nutrient-dense. So you can take it as a supplement if you need to, but organ meats and wild-caught meats and fish have some certain nutrients that she suggests are really good for autoimmune patients. So she recommends 4 ounces of some type of organ meat, wild-caught meat, or fish in your diet plan. But this was her protocol. Also, she recommends good omega-3 fats. This is across the board. All autoimmune protocols add in omega-3 fatty acids. You can either take it as a supplement. A good vetted third-party verified brand is Nordic Naturals. You can either take it in food, sardines, herring, anchovies, salmon, mackerel, or you can do flaxseed, which is a different type of omega-3 acid. It's an ALA, but it's still good. You can also take omega-6, which is GLA, and that's also good for decreasing inflammation. So add that omega-3 in, whether you're eating it through foods or you're actually taking a supplement. She recommends fermented food. Again, across the board, autoimmune protocols are slightly different. If you're on the FODMAP diet, they typically don't recommend the fermented food in the remission stage, but they recommend adding it later as you become a little bit more stable with your symptoms. Fermented food are things like kimchi, tempeh, kombucha, sauerkraut, kefir. You can do yogurt, but again, if you're trying to avoid dairy, you may not want to do fermented dairy and yogurt when you're doing your remission diet. So we talked about elimination. That's a huge part of the autoimmune protocol. If you're not sure what else you should eliminate, sometimes patients will ask me, can I do a food test to see what I'm sensitive to, like a sensitivities test? That's plus or minus with autoimmune patients. The problem is if you have a leaky gut, which is controversial, or you have problems with a heightened immune system, you might come back allergic to a lot more foods than you're actually allergic to. So take that with a grain of salt. You may want to get tested if you're kind of not sure where to start, but just start with the 4 things I told you. Sugar, of course, processed food. You've got your dairy, grains, beans, and legumes. And then you can add in, the beans, the citrus, the soy, the nightshades if you want, okay? So following a protocol is important, but the timeline that you follow the protocol isn't. Some patients are early in their process. They started to have fatigue and pain symptoms and some autoimmune symptoms. They might start elimination and they feel better right away. Some of you might have had symptoms for the last 10 to 20 years before you got a diagnosis. And it may take you a lot longer to get to where you need to be, so be patient with your body. It takes a while to kind of turn the tide on repairing the cells, repairing the mitochondria, repairing the protein synthesis, and getting your gut better again. So patience is the key here, and keep with it. Work with a good practitioner if you're not sure where to start, and keep eliminating things in your diet slowly. Okay, so elimination is the first thing of food items. The second thing is elimination of infections. We talk about the gut as being a huge place where bacteria live. Trillions of bacteria, an ecosystem that we've had for generations is living inside of us. And when we have disruption of that microbiome, when we have invaders, pathogens, parasites and yeast and bad bacteria that come into the system, then it kind of disrupts our ability to process food properly, and it ignites our immune system to become on high alert all the time, okay? So what causes this problem with our gut microbiome? We do. And I mean us doctors, I guess. So we give you prescriptions that can disrupt your gut microbiome. Antibiotics. How many of you guys take antibiotics on a regular basis or call for an antibiotic every time you get sick? This is not always necessary. It actually causes destruction of your gut microbiome, and it can actually lead to an autoimmune condition if you're genetically predisposed. Second, proton pump inhibitors. How many of you guys take acid-reducing medicines on a regular basis? Now, they can be used for temporary use, but chronic use of antacids like omeprazole and Nexium and Protonix can lead to dysbiosis of your gut. It can open up a portal for bacteria to make it into your small bowel, cause infestation, which can then also trigger your immune system. Anti-inflammatories like ibuprofen and Aleve are not good for the gut. So folks, when you're taking chronic anti-inflammatories for your joint pains, it can actually cause disruption in your gut lining. So be careful about using ibuprofen and Motrin and Aleve on an ongoing basis. You've got artificial sweeteners. How many of you drink diet sodas? If you drink a lot of Diet Coke or diet drinks or diet food, that sure is going to cause disruption of your gut microbiome and kill all that bacteria. How many of you eat foods that are sprayed with pesticides? Pretty much all of us. So those pesticides are also decreasing the healthy gut microbiome. So this is sort of a scary picture, right? Your gut microbiome is being destroyed. The gut lining is becoming more porous. We have pathogens in our colon that are igniting our immune system. These particles of food and chemicals and bacteria make it into our bloodstream. These particles seed into our connective tissue, into our glands, and ignite our immune system to target that organ. right? So we develop antibodies against the thyroid or antibodies against our connective tissue or our joints because it's chasing after all these things that are coming out of our gut. So sealing the gut is the first step, okay? And fixing the microbiome by eliminating medications and toxins that can destroy the gut lining. The third toxin that you're going to talk about removing is chemicals in our environment. I talked about it last week. So you've got plastic, you've got nonstick, you've got BPA and PFOs and PCBs and chemicals that are in our food system, people that cook with plastic or eat on plastic or heat up plastic, nonstick cookware. We talked about makeup and skincare products and how these products can actually cause endocrine disruption and also can cause autoimmune activation. So try to work on cleaning up your environment, whether it's flame retardants, whether it's cleaning supplies in your home, whether it's pest spraying that you do, where you get your food from, buying organic so that you're trying to be as clean as possible, especially for the dirty dozen, which are the heavily pesticided fruits and vegetables. Try to remove toxins. We talk about heavy metals. A lot of people ask about that. And so mercury, lead, a lot of things that are in our water system, in our fish. So just be mindful about the products that you purchase and the things you eat to reduce the amount of toxic chemical burden. If you suffer from autoimmune conditions, this is going to ignite your immune system, okay? So starting with an elimination diet, eliminating highly inflammatory foods, even if they're healthy, they might be for you not the right thing to do. Slowly introducing them one food group at a time based on your timeline with your provider, based on relief of your symptoms. Second, getting rid of things like medications or food products that can destroy your gut microbiome to help you reset a new one. Third, getting rid of toxins in your environment that might be poisoning your system and activating your immune system, okay? So now that you've eliminated a lot of things, how do we replace and replenish? That's the question that people want to know. So now if your symptoms have started to get better, or maybe they haven't gotten better, maybe you're missing something. So the common thread through all the autoimmune protocols that I looked at was replacing a nutrient-dense diet to help rebuild the mitochondria, the cells, the nutrition that your body needs. You can take it as a supplement if you want to, but I encourage you to try to get it through food. We talked a little bit about Dr. Wall's protocol with vegetables, fruit, her addition of meats, organic fatty acids and fiber, but you can also take nutrient supplements that increase your vitamin A. So she is a big proponent of retinol or carotenoids. B vitamins, especially if you have neuropathic symptoms, so B12, B6, folic acid, those are important. Vitamin D, again, a really essential vitamin for so many things, but definitely for autoimmune patients, add in that vitamin D. Omega-3 fatty acids, we talked a little bit about that earlier, but again, you could take it as a supplement. She recommends calcium, magnesium, zinc, selenium, so a good solid multi that gives you all your minerals and vitamins are important. In my clinic, a lot of times I'll do a SpectraCell nutrition test. It's a 33 vitamin, mineral, amino acid, fatty acids test, tells me what the patient is deficient in, and that allows me to then cater to those deficiencies by telling the patient what supplements they need to take or what foods they need to eat to get those nutrients up, okay? There are some spices that I recommend, ginger and turmeric and rosemary. So if you like to cook, add that in there. Good morning, Adriana. You're asking about L-glutamine. Excellent. I was just about to get to some of the supplements, so hang in there. So spices like ginger and turmeric and rosemary are good. And one of the things that Adriana is asking about is supplements like L-glutamine. L-glutamine, 4 to 8 grams of the powdered form, has been shown to help with gut healing. Now, there aren't a lot of randomized controlled trials that are out there to support the use of L-glutamine, which is an amino acid. But for those of you who suffer from gut dysbiosis, it's definitely worth a shot. If you wanted to help make your gut a little bit healthier, talk to your doctor, make sure it's not a problem for them and any of the medications you're currently taking. But L-glutamine is something that is antidotally recommended for gut healing. The other one that's also recommended a lot is berberine. And there's actually some really good studies on berberine, 40 milligrams of berberine, 400 milligrams of berberine, to help with healing the gut. It has antiviral, antimicrobial properties. So if you have gut dysbiosis and an overgrowth of yeast or bad bacteria or small bowel intestinal overgrowth, berberine is usually one of the things that's in the protocol to help reset that gut dysbiosis. Let's see. Boswellia is also another one that people recommend. Quercetin is another supplement that people take for gut healing. Tracy is saying, I have been battling a bad gut for years, been at the Mayo Clinic in Minnesota, now seeing doctors at Northwestern in Chicago, and they're still at a loss of what I have. Absolutely, Tracy. Getting a diagnosis can take 10 to 20 years. Remember that the inflammatory cascade starts way before the actual organ getting destroyed. So if you wait until the organs are completely destroyed to get a diagnosis, you might be too late in actually getting some repair. So if you are somebody who's just starting to feel fatigue, chronic pain, brain fog, odd symptoms like dry eyes or dry mouth, or weight gain, or sluggishness, or you're having bloating or gas or cramping or diarrhea or constipation, and your doctors can't figure out the symptoms because there's just too many of them, you may have an autoimmune condition, and don't start until after you get diagnosed. Listen to me today and make some steps to help reverse some of the autoimmunity that might creep up on you over the next 10 years. Hopefully this is helpful for you. Okay, so getting back to the supplements, we talked about berberine, we talked about L-glutamine, we talked about boswellia and quercetin, we talked about ginger and turmeric. These things can be added into your diet. A big reset with your gut is probiotics. So a lot of patients will ask me, should I take a probiotic? If I do, what should I take? It's plus or minus based on your symptoms. Sometimes you want to do an elimination first before you re-inoculate your colon with bacteria. So just like with the fermented foods, some patients may not really tolerate prebiotic and probiotic foods, and they may want to clean their gut first, give themselves a period of time, and that's just dependent on the patient, before they re-inoculate the colon with probiotics. Whether you choose a product with lactobacillus or bifidobacterium or Saccharomyces, or a combination of all three like VSL, or you decide to eat more fermented food and add in prebiotics like garlic and ginger and plants like cabbage and carrots and inulin and chicory. These are all things that you might want to wait until your gut feels a little bit better before you re-inoculate. But you can re-inoculate with real food that's fermented. There's some good studies on Saccharomyces, because I looked at probiotics to see if there's any real evidence base to suggest that. And so if you have ulcerative colitis or if you have Crohn's disease, there are some good studies to show that Saccharomyces might be beneficial as a probiotic for you. Okay. I'm just reading questions. Sorry about that. Okay. So going on to that, the next group of supplements that people ask me about are adaptogens. You've heard me talk about adaptogens maybe in the last talk. They help with stress modification. These are things like ashwagandha or rhodiola or holy basil or astragalus or ginseng. I want you to be cautious. If you have an autoimmune condition, ginseng and astragalus actually can activate the immune system. So if you're just looking at a blog or you saw somebody mention it and you decide to take it, be careful with adaptogens. They can actually ignite the immune system. So before you take any supplements, please talk to an integrative or functional medicine doctor or your primary care doctor or your specialist to make sure that it's going to be right for you. Okay? So these are some of the things that you can do to add back in. We talked about the Walls protocol. We talked about the FODMAP diet. If you have small bowel intestinal overgrowth, you may want to follow the FODMAP diet. You can look it up online, and that actually helps with, again, eliminating some of the foods that can cause more inflammation in your colon. Okay, so we talked about reinoculation. Moving on, lifestyle. All autoimmune patients will say that if they don't get a good night's sleep or they're heavily stressed, it is inevitable that they're going to have a flare. Okay, that's a given across the board. Autoimmune patients typically will say that under stressful situations or loss of sleep, their immune system is a mess. Okay, their symptoms are ignited. And remember, the symptoms are not the problem. They're just telling you that there's a problem. The problem is your immune system is causing this flare, whether it's weight gain, whether it's fatigue, whether it's brain fog, whether it's pain symptoms. They're not the problem. The root cause is your immune system causing inflammation. So work on decreasing inflammation and the weight will get better, the brain fog will get better, your mood will get better, your energy will get better, and your pain will get better. So work on this protocols, work on your gut, and everything else will follow. Okay? So lifestyle, sleep. I talk about sleep a lot. If you haven't watched my sleep video, I did a whole segment on sleep, starting with sleep hygiene, also supplements that help with sleep, teas that help with sleep, exercises like autogenics, meditation, breath work, food additives that can help with sleep. So work on your sleep on a regular basis. I'm not going to touch on it too much today since we have so much else to talk about, but sleep is a huge component. Stress. Stress is a huge component. All of us can appreciate that when we're stressed, everything gets worse. So I'm a big fan of mind-body work. I talk about doing 30 minutes of meditation every day. I talk about including exercise in your daily routine. I know it's difficult. You've got a lot of pain. It hurts. You can't move. But movement is really important if you want to overcome this on your own. 30 minutes of movement, even if it's Tai Chi or chair yoga or Qigong or stretching or water aerobics or water movements, these are all things that you can do to help get that movement in your body. It also reduces stress. It also helps with weight loss. So these are all important things to add in. Okay, there was a study that they did on patients with psoriasis. It was done in 1998. And they put them in a UV light box to treat their psoriasis. Half the group meditated while they were getting their UV light treatment. They had a 4-time faster recovery from their psoriasis than the patients that did not meditate. Now, I know meditation can sometimes imply some type of religious connotation, and I've talked about meditation before. It's not. It's actually just taking an inward gaze, slowing down your breath, and concentrating on lowering your fight or flight response. If you don't know how to meditate, I have several videos on meditation. Feel free to watch any of them and incorporate that into your life every day to lower your stress levels, as this decreases the hypothalamic pituitary axis. It shuts down the vagal tone that sends signals to your adrenal glands to pump adrenaline and cortisol into your bloodstream. And when you downregulate that stress response, you're not causing inflammation. You're shutting down cortisol and epinephrine, and you're actually slowing down your breath, slowing down your blood pressure and your heart rate, and it's actually reversing the fight or flight response and helping inflammation. So stress and sleep are paramount. If you're not doing that, you're not going to get ahead. If you're eating junk food, you're not going to get ahead. So start with the things that you can do and work towards being better every day. Okay? So you're going to see your doctor. I know Tracy has a few questions about specialists that she's seeing and testing that she's had done. So educate yourself about your symptoms. And if you're curious about a particular condition, do some research, read about it. Come in educated. Your doctor likely will order some blood tests. They might order some antibody testing. Remember that most people have negative antibody testing in the beginning. By the time you have antibody testing positive, there's already injury to the organs. So having negative antibody testing doesn't mean you don't have the beginnings of an autoimmune condition. They might ask you to do scans. They might ask you to do biopsies or lumbar punctures. There may be a lot of cost involved. There may be some testing that you do, micronutrient testing, stool analysis. You might do SIBO testing. You may have endoscopies. There is a process that you have to go through in traditional medicine to get a diagnosis, but don't wait for the diagnosis to make the changes I'm recommending today. Once you have this slew of blood tests and slew of testing, you may still not have a diagnosis. They might say to you, you have mixed connective tissue disorder, or you have maybe a smoldering autoimmune process, but we don't have a name for it. That's okay. Getting to a dead end isn't the worst case scenario. Having a diagnosis makes you feel better, but you don't need it to validate that something is wrong, right? So you go with that feeling and work on how you can help reverse the process. Okay, so now you've had all your testing done, your doctor is likely going to suggest medications to help you with your symptoms, because allopathic medicine is disease-oriented. We talk about the symptoms, not the root cause. And we give you drugs to help you with the symptoms, but not necessarily fix the broken mechanism in the body that's causing the symptoms. Now, I'm not saying medication is bad for you. I think there's a role for medication. If you already have tremendous amount of pain, you have tremendous amount of destruction of your joints, if you're a diabetic and your pancreas is shot and you need insulin, if you're having thyroid problems and you need to have thyroid replacement, you may need to take these medications. You may want to have them check your hormone levels. Remember that patients who have autoimmune conditions have more than one. Typically, there's a combination of them that you might end up getting. So have your doctor check for multiple autoimmune conditions, because it's not unlikely that you're genetically predisposed to multiple diseases. So have them check your hormones, have them check multiple other autoimmune conditions. If you have an autoimmune condition, you're at higher risk for heart disease. Did you know that? Patients who have autoimmune conditions like rheumatoid arthritis are 3 times likely to have a heart attack, not because of cholesterol, because of inflammation. So make sure that you have your heart checked. Also, cancer risk. Patients with autoimmune conditions are at higher risk for having cancers like lymphoma. The reason for that is because the immune system is distracted. It's doing something else, and cancer goes undetected. Good morning, Alan. So remember that you want to ask your doctor for other testing, other autoimmune testing, cancer testing, cardiac testing. Make sure you're getting checked out properly. Make sure you're asking them about side effects from your prescribed medications, because there are side effects, but the side effects might not outweigh the benefits if your disease is severely progressed. Okay? There are some other alternative things you can ask your doctor if they're comfortable doing. If you have a yeast overgrowth and you want to take antifungals, or if you have a pathogen in your colon and you want to take an antibiotic to get rid of it. If you have small bowel intestinal overgrowth, you may want to take Xifaxan, which is an antibiotic for that. You might decide that you want to take low-dose naltrexone, which has been studied with ulcerative colitis and Crohn's patients to help them get into remission. So you might ask for other medications that are prescription that can help you with your symptoms. Okay. So the last thing you want to ask your doctor is for referrals. As an integrative practitioner, I strongly believe that you need to be able to reach out to other practitioners that might help support you in your condition. You might want to see a physical therapist if you have a lot of musculoskeletal issues and help you with movement. You might want to see a massage therapist or an acupuncturist. You might want to see a counselor if you're really struggling with mood issues. You may want to go and see a nutritionist if you're lost as far as what you should be doing with your nutrition. So use allopathic physicians as your landing post, and then find other practitioners in your community that might help you reset your balance and get you back on the path to wellness. Remember, if you have an autoimmune condition, we're not talking about cure. We're talking about quality of life and remission. We're talking about balance, restoring balance in your body. And you're going to have ups and downs. That's natural. It's just knowing the ways and the tools for your body to get back into balance using nutrition, using stress-reducing methods, using exercise and good sleep hygiene, using those tools in addition to your doctor's medications to help you get back your health. You can't rely on your doctors to do all the work. It is a 50-50 effort. So I encourage you to lean in, find out about your disease, incorporate some of these lifestyle choices, research your condition, and then bring that information to your doctor and partner with your doctor so you can help yourself feel better. So I'm going to end, like I always do, with a mindful exercise. There's actually a study that shows that when you do gratitude journaling, it reduces your symptoms by 25%. So if you can't do anything else today, start with a gratitude activity or a journal, 15 minutes a morning. Journal in your diary things that you're grateful for. Now, you might be struggling with that. You might say, I can't think of anything to be grateful for. I feel tired all the time, I'm miserable, I'm in pain, I can't function. But remember, there are always things you can be grateful for. You can be grateful for the people in your life. You can be grateful for air that you breathe, running water, indoor plumbing, electricity, right? The ability to be awake in the morning, the ability to eat, have your arms and legs. You can also then spread that gratitude to your pet who you may love. You may spread that gratitude to your children or grandchildren that have been present. You might spread gratitude to your coworkers or somebody who's been very supportive for you. Find gratitude every day in your life, because that actually turns the conversation to what things are going well outside and takes away energy from the focus of what's not going well inside, okay? So gratitude, that's your exercise for today. All right, everybody. Well, thank you so much for joining me today. If you have any specific questions I can answer based on what I presented today, please don't hesitate to add them in the comments. I'm happy to answer any questions today. Thank you, Karen, for joining me. And I will be here next week, next Saturday, 10 o'clock. I'm going to talk specifically about thyroid disease. So I'm going to take that condition by itself. And then I'm going to follow that up with other conditions that are very common, like multiple sclerosis or rheumatoid arthritis and lupus. So if you have anyone that can benefit from this talk, please share this video and please let them know about these talks on Saturday morning. All right, guys, have a great day. Bye-bye.